The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Welcome to this edition of RUMC Vital Signs. If you've ever thought about working in healthcare, or you're already on that path and wondering how to stand out, this episode is for you. In this episode, we're joined by an HR hiring specialist who reviews resumes and helps build the healthcare workforce every day. We're going to talk about what employers are really looking for, how to prepare for interviews, maybe surprise you with some interviewing myths versus facts, and show you how to position yourself for success. I'm joined by Romeo Smith, Senior Recruiter in the Human Resources Department at Richmond University Medical Center. Romeo has years of experience in workforce compliance, recruitment, regulatory adherence, and employment law in healthcare and administrative sectors. Romeo, welcome to the show.
Thank you, Alex. Thanks for having me today.
Thank you. Before we dive into resumes and interviews, let's start with a big picture view. From your perspective, what makes careers in healthcare so attractive?
You will always be employed. I mean, look what
true.
we just went through with COVID.
Right.
And everyone needed healthcare. I need nurses. I need doctors. I need housekeepers. I need dietaries. I need staff, basically. So when you look at healthcare, we are sort of recession-proof in such a way, but there's always a need.
Gotcha.
So it's just creating that need and saying, okay, we need staff. Where do we get them from? Is it schools? Is it job market? Where is it? So
when people are looking for jobs or they hear the word healthcare careers, what do they usually picture and are they missing anything?
they usually think about nurses and doctors. That's the first thing when they say healthcare. And I like to say, no. When you talk about healthcare, you're covering finance, you're covering HR, you're covering dietary, you're covering housekeeping, you're covering HVAC. It's all those things.
So it's like support services.
Yes, it's all support. We're all there for one goal, the patient. One goal, because we're helping each other serve that patient. So if you have a clean hospital, guess what? You have a patient who wants to come back. If you have good doctors, good nurses, good radiologists, they want to come back. So it's really a service industry.
And the people that you're recruiting now, I mean, let me ask you this, has recruiting changed in any way since the pandemic that you mentioned?
It has changed. It's changed in a big way that it's a candidate market.
Okay.
So what we're encountering more and more is candidates. We're going to go to an interview. Great, they're going to show up. The question is, are they going to take the job on day one when they start? Sometimes we have candidates say, I decided it's not for me. So we're not returning. Or you don't even hear from the candidate anymore. And you're like, what happened? And then you finally hear from them 6 months later, oh, you know what, it wasn't for me. I decided to do something else at the last minute. Or even better yet, my old employer called me back to work. And I decided to go, they offered me more money. And that happens. That happens all the time. More times than people would say that it doesn't. But it does.
Did you find people who expressed an interest in a healthcare career who then changed their mind because of the pandemic?
Yes. I always look at and we could talk about what the programs we have, was when I have the kids come in to, let me shadow a doctor, let me shadow a nurse. And then they see, for one of my students, he just saw, the nurses had to clean the patient. They're like, oh, fascinating, but I want to be a nurse. So I saw something I would never discussed in school, and that happens. Sometimes they'll see, oh, unfortunately, a patient expired, and they'll say, this is not for me. I can't do it. And I'd rather them do that then in shadowing than we hire them, they're working, and 3 months in, they're like, this is really not for me. And then they leave.
So the people that you're recruiting, now, are they, what types of roles are the highest in demand right now? Highest
in demand, of course, everyone's going to say nurses. Nurses number one, but really it fluctuates greatly. I'll say radiologists number two, MRI techs, X-ray techs, respiratory techs. With all the things that are going around today, you see in terms of RSV, everybody talking about COVID, breathing. Respiratory therapists are a number one demand. Really? Finding them. But they have to do, and part of the backlog is they have 2 years of schooling. And getting them there and training is much more important right now.
Right, this is not just a general position that you can get off of Indeed or something and find somebody like that.
Correct. Very specialized, because it's all about how well is that patient breathing. What do we have to do? Do we have to tube them? Do we not have to tube them? What's going on? What are their symptoms? So you want that specialized care, and it goes with training. Sometimes staff will go, you know what? I've been here 30, 40 years. I think I'm done. Then I say, well, why don't you come back and work one day a week? Because you'll miss it. You'll miss those days when you're totally busy. You want to pull your hair out. And then you're like, you're right. I come back. I've had nurses who have retired after 45 years. I'm coming back to work one day a week. Just because, why? It keeps me going. It gives them something to do. They're like, I have that camaraderie with my old staff again. And I'm still learning. So that's a good thing.
Do you find that a lot of the people who are applying for jobs now, are they students just starting their career, or do you have a lot of people who are looking to change careers?
I think more so, I see more young people now looking at healthcare as a viable career field, but I have those who say, you know what, I'm tired of I was on Wall Street, I don't want to do it anymore. I want to do things that bring meaning to my life. I want to be in healthcare, I want to be patient facing. I want to talk, and I want to see people. So I see more, it's becoming a 50-50 split. More young kids are coming in, but more adults are saying, I'm changing my whole entire look. I want to go into healthcare.
And as a recruiter, does someone who wants to change careers, it's not necessarily a turnoff to a position? Because I know some positions it can be like, oh, this is someone who's looking to change careers, and I'm a little leery of that.
That's where the interview comes in, and that's where they start to set the tone for, why do you want to do healthcare? You were making good money on a for-profit world. Why do you want to come here? And they tell you the story, and you're like, that's the selling point. That's where you capture them, and that's where first impressions are key. Well, let me show you around. Let me show you what you're going to encounter if this is your first time. If you're returning to healthcare after a while, you're like, oh, this is what I missed. Now I want to come back again. So it's really capturing them at that first moment.
And in your position, I would imagine you have to be up on the latest terminology and trends, because you're interviewing people. If you don't know what you're talking about.
Well, that's where I go to my managers, and I talk to my managers and say, what are you really looking for?
Right.
Tell me what the expectations are. Help me help you set the expectations. So when I'm interviewing that potential candidate, I'm screening them, they're saying all the key things that get me to go to that manager, like, you really want this candidate. Look at this candidate. Or sometimes a friend of a friend will say, look at this person's resume. And then I say, you know what, I'm going to call them. And just ad hocly, if the time allows, I'll give them a call, and we got into a conversation. And my conversation is usually 5-10 minutes. If we go 15 minutes, I'm like, they're dragging me in with them. I'm like, this person, I like their style. They're really getting me interested in what they can do. So let me bring them in for an interview. And I tell the manager, and I send them notes. This is what we talked about. This is what they shared. Ask them questions on this. So we like to share that feedback, per se, to give them a heads up of what they're getting into in terms of an interview.
And in your role, what do you find most rewarding about what you do?
Oh, I could tell you several different things. First of all, when I have an employee who says, after 8 years, one employee that comes to mind, she said, I spent 8 years in the ED as an MA, and I paid my way through school, and I wanted to become a nurse. And I said, well, we're not going to let you leave. Your enthusiasm, all that knowledge you have, let's take you to the next level and have you a nurse. And then I have the students who come in, and they talk to me, I'm like, oh, we like this person because they're MRI tech. We like radiology. Or, as one of my techs would say, oh, we're going to get you out of pre-med. You're coming to radiology, and here's why. So it's all those things. But I like it when, most importantly, when I see, and I'll say it, I won't call it our lowest paying field, but when I have a housekeeper who said, listen, I paid my way through school, I did what I had to do, I worked, and I want to be a nurse. And I'm like, there you go. That's the goal. Where I want to be a radiologist. I want to be a respiratory therapist. Hey, can you help me? I got my social worker license. Now I need to do my internship as part of this. Can I do it here? And I say, that's what I want. That's what I'm looking for. Because they want to stay. Especially they want to stay at RUMC. It's like, why? We like the environment. It's a family. It's everything.
That's great. So on that note, we'll take a quick break. When we come back, Romeo will walk us through what he looks for when recruiting, providing tips for building your resume, share some do's and don'ts that can open or close doors on a career in healthcare. Welcome back. A lot of people don't realize that recruiters spend only a few seconds reviewing a resume during that first pass. In this segment, Romeo will take us to his side of the interview desk when resumes come his way. When a resume lands on your desk or on your computer, what are some of the things you're scanning for?
I'm scanning for education. I'm scanning for their prior positions before they want to come to us. And I'm looking for overall content and any mistakes in their resume that I would pick up on. Is it AI generated? Is it, oh, I missed a word, I misspelled the word. Sometimes I become my old English teacher with the red pen. I'm going through and I'm circling certain things.
What are some of the common mistakes that you see in a resume that turn you off as a recruiter?
You know, it's not one particular thing, but sometimes you'll read a resume and you're like, their resume catches your eye. I'm like, what's going on here? Or they leave out dates. That's almost an immediate red flag. Why are you leaving out dates? Give me dates. When were you employed? And then I'm doing the dates and I'm doing my math and I'm like, well, why were you only there? So I'm focusing my attention on certain things.
Right.
So give me an explanation of why there's a gap in your resume.
Okay.
And I don't like to see gaps, but gaps happen. Life happens.
Right.
So if they tell me, oh, you know what, I had to take care of a sick family member. Got that. Understandable. With a lot of my older applicants, I find, you know, I had to move home to take care of my parent. Got that. I can understand that. Then tell me that and put it on your resume. Say, I was my parents' home health aide. And that happens. That happens more and more. That people don't want to say they do it, but they do. So.
Now, I know you and I work together, so you have said this before, but you've actually gotten resumes that include a photo.
Yes, yes. So, and you know what? I always tell people this. Don't use your photo, unless you're going for marketing or advertising or a model. Do not send me your picture. I want to say, let me read your content of your resume. Everything aligns perfectly. I want to bring you in because you're setting the stage. If, let's say, I can tell in your picture your tie's crooked. Oh, poor dresser. Or I can look at it and it's in color. What is this color scheme going on? Right. It takes away from the content of your resume. Keep it simple. Keep it that it's very pointed, it's very simple. Give me stuff that I need to know. And a lot of people don't talk about cater your resume to the job. So when I'm looking at a resume or someone asks me or I'm looking at a position, I'm like, cater your resume to that position. Look for keywords in that position that you can put it on your resume. And if it ties in, perfect. So more times than not, I'm seeing people, oh, I'm going to apply to 20 positions and I'm just going to send my resume. And I'm going to look at their resume. You're talking about admin, but you're an HVAC guy. Help me understand. There's a disconnect somewhere.
Right.
Are you sure you're looking for this job? And then sometimes I'll paint for them the reality. Well, this is what happens. If you're trying to get your foot in the door, you got to start somewhere. It's going to be part-time for now. I'm not saying you can't move to full-time, but get yourself in the first step of getting yourself to the door. Get hired first. Then move around. Figure out your niche. Where do you want to be? Where do you want to go? Oh, I don't like radiology, but you know what? I like the ED. It's more excitement. It's super busy. That's what I like. Great. I always have ED positions open. So let's get going with that.
So someone's watching this episode, they're taking notes, they're putting their resume together. What are some of the essential sections they should include in a resume?
If you're a licensed individual, please, oh please, give me your license, give me your education. I want to see that. Give me an opening statement that tells me who you are so I can narrow it down. And then go into your jobs. Or if you're a more seasoned professional, you have 20 years and you're looking for, I want to change jobs. Then paint me a picture. That tells me your summary is going to be broader, the things you bring to the table. I would say your core competencies are going to be greater. You're going to highlight the things that I want to say, oh, you had employee relations. Oh, you had a lot of admin experience. And I'm putting you in a registration role. Oh, you had a lot of insurance experience. Those are the things I want to see because that tells me it's a faster interview than, okay, I have to sit here and decipher a resume. And again, I have to bring out the red pen. Oh, mistake, mistake, mistake. I said I have a limited amount of time. Let's say I have 100 positions I'm recruiting for. I have to spend that time and be very pointed. Who's qualified, who's not qualified. I said I don't have time to go back and say, well, I'm energetic, I'm experienced. No, your resume has to tell that story for me. Let your resume talk to that story, talk to that position. And then I always tell people on this hindsight, have 4 to 5 resumes. If you're an admin, talk to it. And then you can say, well, oh, I have a registration clerk, or I have a nursing assistant position. They're all admin roles. How are your customer service skills? And that's what I look for.
I see. And our final question for this segment, so you touched on it earlier, so is it okay to use AI to help put your resume together?
AI is a tool. Use it as a tool, but don't let AI write your entire resume. Because then when I bring you in for an interview, let's say perhaps I don't do what somebody else does, and you get past one person. I'm going to start it. I said the manager is the key holder on this. They're going to quiz you, and they're going to say, you have no idea what you're talking about for this position. You've never experienced these things. Or I'll get into a conversation. In five minutes, I'm like, you really haven't done this job. Who wrote your resume? And they start, and they're like, I have no idea. Well, I start asking questions. What happened here? But that doesn't match what you just told me you were responsible for. Or you'll talk all the way around the job, and I'm like, you're not giving me specifics. Problem. Red flag goes up. Red flag. And then I say, danger. Danger, Will Robinson. No. So all those things come into play.
Gotcha. Well, now that we know some do's and don'ts, let's keep that theme going. When we come back, we'll ask Romeo to separate some myths versus facts when it comes to pursuing a career in healthcare. Stay tuned.
Learn more at adoptuskids.org.
If you've ever felt discouraged by something you heard when applying for healthcare jobs, you're not alone. That's why we want to do a quick myth versus fact. These are some of the misconceptions job seekers believe and the facts that can help you move forward with more confidence. So Romeo, we're going to ask very quickly some myths versus fact. You say if it's a myth or a fact, and if you want to give us some information, that'd be great.
Okay.
So myth versus fact. If you don't meet every job requirement, you shouldn't even apply.
Incorrect. That's a myth. I think if you meet the majority of the things that are listed in the job description or on the job posting, great, apply. Because some of the things that you're seeing on the job posting can be learned on site. It's your ability to translate and answer the questions in the interview. Like I was saying, talking about earlier, interviews are nothing more than conversations. It's a sharing of information. Where do you see yourself? How do you see yourself in this role? Ask questions from the manager. Well, why is this role empty? Is it a new position? What happened to the last person that was here? Ask those type of questions and say, well, this is where I see my skill sets as being a benefit to the team. I take nothing personal. I learn very fast. All those things lead into say, you know what? Get that manager comfortable with you, not your resume. Now it's a you thing. So now you have to sell yourself.
And you touched on this earlier, but I'll ask it again. So myth versus fact. One resume works for every healthcare job.
No, Absolutely not. Cater the resume to the job. That is paramount. I can't stress enough. Sometimes I'll look at a resume and they'll look at me again, the English teacher's red pen comes out, and I'll go right on the keyboard, decline, decline, decline. Why? Because it's not tailored to that job.
Myth versus fact. Interviews are not only about your technical skills.
That is true. That is completely true. Because you're selling yourself.
Right.
You are the ultimate car salesman of your career. So help that manager say that that's the best candidate I want for that job. Your enthusiasm. I'm not saying jump up on the table and say you're the biggest cheerleader, but really the interview, not even interview, the conversation you're having. Make it pointed, make it listen. Sometimes listen means a lot more that, okay, well, this is where I see myself based on what you told me about this position. This is why I'm interested. This is where I want to go. I said I'm a new graduate. I want to learn. I want to do this because I used to take care of my sick parent, or I took care of my sister when she was younger, or it just depends. Find your story to build that conversation. Once you do that, that interview is nothing more than a conversation.
Myth versus fact, and you touched again on this earlier on, gaps in your resume automatically disqualify you.
No. I think some people, when I did this during COVID, a lot of the candidates say, well, I'm taking care of a sick parent. I said, no, fill in the gaps. Tell me you were taking care of a sick parent. You had to leave your job because it was a family choice. You had to take care of a sick child. All those things build a stronger resume because it shows you're responsible, you're conscientious, and you care. And those are all selling features in healthcare. I care about the job I want to present. I'm not going to call off just because I'm sick. It's like, what's a weakness? My weakness is that I'll show up on my days even when I'm sick, because that's how much I value my job.
And our last one, myth versus fact. Even after you're hired, your resume still matters.
It does. I tell people 6 months in, 6 months to a year in the position, update your resume. Update it, because why? You're learning new things, and then you're improving your skill sets. Every time your company changes the software system, guess what you do? Add it to your resume. Why? Because you're the one who, I have to use it, I'm in there. And for example, also we went to Workday. I'm like, what do you think I do? I had a Workday to myself. I had no choice.
Well, thanks. As you can see, a lot of the rules people believe just aren't true. And knowing the facts can make the process feel a lot more approachable. So now you have your resume, you've applied, and you finally got the call for an interview. When we come back, Romeo will walk us through how to prepare for that interview so you can put your best foot forward.
I am blind, but I need not see. I know this road is there for me. If I'm really free.
It's the day of your interview. You've made it this far, so let's make sure you ace the interview. Romeo, what should someone do the day of their interview, even before the interview begins?
Prep yourself on the organization. Prep yourself on the actual position you're being interviewed for. Have your statements ready. Please, oh please, if you know you're coming in for an interview, don't arrive 15 minutes before the interview. Give yourself that leeway, that 30-minute window to come in and decompress. If you're running, it's like, especially here on Staten Island, oh, we have traffic. Well, create a half an hour gap window so that you're sitting there like you're in a doctor's office. They give you that 15-minute window to calm down, prep myself, just go back over, look at your resume, go over the job, and then get ready. And come in dressed professionally. Even if you're going for a mass or career fair, dress like you want the dress for your next job. And that's the job you're looking for.
Is there any advice you would give to someone that's preparing for an interview that's being done remotely?
Yes. Do not show me your bedroom. I do not need to know you burn candles. I could tell you horror stories, and I'm like, oh, interesting. Oh, I could see your shelf. I could see your clothes in the background. Don't do that to yourself. So, with AI, with technology now, you can put a fake background. I'd rather you have a fake background that all the focus is on you. Right. And I think a lot of people say, well, I can't handle multiple people in the same interview. It's like we're doing now. I'm like, whoever asks you that question, you look that person in the eye, you answer the question. If it goes round robin, that's how you make it. You just work with it. And be prepared. And I always do this when I send people or confirm them for their interview. Dress professionally, arrive on time, have multiple copies of your resume. That shows you're really interested. And be there, be in the moment. And always remember, shut your phone off during the interview.
And what makes a good, strong first impression for you as a recruiter?
Is when that person's on time. If they beat me to that interview online or in a Zoom meeting, that's absolutely perfect. Because when they don't think I'm looking at what they're doing when that camera is on. And it's like, oh, they're reading over their resume, they're putting stuff in order. That means they're getting organized. I love it. When I see them fidgeting, or for one bad example, they lit a candle. I'm like, are you kidding me right now?
And after an interview is over, what are one or two things that people can do or do that leaves you with a good impression that you would then consider to move them on?
Send a thank you email. That says so much about the person.
So that doesn't happen as much anymore?
That doesn't happen much anymore. And it should, because you're recalling, after you leave, you get to digest what you actually experienced. And then you get to recite to the manager what you just talked about. That proves that you were paying attention, that you listened to the conversation. It will say a lot more, and I remember the days they used to handwrite a thank you. Yeah. And if you do that, that says a lot more about your capabilities than anything else. And if you hit key things the manager talked about, that tells the manager, I'm a good candidate. They paid attention. They listened. So I remember, if you listen, that job is yours.
Good advice. So hopefully that gives you some good advice to get through the all-important interview. When we come back, we'll wrap up our episode with some parting words of advice from our special guest.
What are you looking for?
As we come to the end of our episode, hopefully you're in a better place about what it might take to land a job in the healthcare profession. It's only fitting we let our guest have the final word. So Romeo, what are some last parting gifts of advice that you would give to anyone who's watching this episode and getting ready to apply for a job in healthcare?
Please read the job posting. Cater your resume to that job posting. Please be on time for the interview once you get that interview. And send a thank you note. Thank you for taking the time out. I've seen interviews where the candidate is waiting around 20, 30 minutes. That says a lot to that person, that they have patience. In healthcare, no 2 days are exactly the same. You can have a busy day and you can have a really busy day. And that, if you can adapt to that, welcome to healthcare.
Well, thanks for coming on the show.
Thanks for having me.
If you're interested in a career at Richmond University Medical Center, visit rumcsi.org, scroll to the bottom of the homepage, and click the Careers tab. For additional information about Richmond University Medical Center and our full array of services, you can visit our website and also follow us on Facebook, LinkedIn, Instagram, and X. Richmond University Medical Center has cared for Staten Island for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. To donate, visit our website and click on the Donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
This program was produced through the facilities of Community Media of Staten Island.